Well, Lauren, the nursing shortage issue isn't just an issue or a problem at a place like a big hospital setting like Wake Med. They are needed at nursing homes, at schools, and in public health. Tonight, we're diving into what could be done to fix this, and we're learning that this is not a quick fix.
You name the area and there's a shortage there.
The calls to do something tonight about the nursing shortage throughout the state get louder.
It certainly is more than we have ever seen.
Dr. Dennis Taylor has seen people and then some leave. He's a nurse practitioner with Wake Forest Baptist Health.
Right now, we need somewhere in the range of 8 to 10,000 new nurses every year, just to replace those that are leaving the workforce.
He's also immediate past president of the North Carolina Nurses Association.
Certainly, we knew that there was going to be a shortage coming with so many people, those baby boomers that are in that age group getting ready to retire.
He said the pandemic exacerbated a problem that's been brewing for years. A new study last month from the National Council of State Boards of Nurses showed nearly 100,000 registered nurses left the workforce in the past 2 years because of stress, burnouts, and retirements, and hundreds of thousands more plan to leave in the next few years too.
It relates to the health of the nation. Nurses are the heartbeat of healthcare.
Dr. Ernest Grant spent more than 30 years bedside at UNC hospitals in Chapel Hill. He's also past president of the American Nurses Association. Dr. Grant reminding us how critical nurses are in keeping us healthy.
Nurses pick up on those subtle things and are able to, essentially prevent those from growing.
He said it's essential to put more money into nursing education, and right now nursing schools can't enroll as many people as they need to fill the gaps. Dr. Taylor continuing to talk about what keeps him coming back every day to inspire others.
I really enjoy what I do and helping people, usually during the worst day of their life.
And we know the crazy kinds of shifts that everyone in a hospital pulls. That's why experts say there needs to be a focus if they want to recruit more nurses on mental health and well-being. So perhaps some proposals include reducing some of the 12-hour shifts that they do 3 days a week, maybe reducing those shifts to 8 hours or splitting up those 12-hour shifts into 6 apiece to 2 nurses. Lauren?